fixing your skin with a laser. What's up? Are you confused by all the skin lasers out there? Well, my name is Dr. Sagar Patel. I'm a double board certified Beverly Hills facial plastic surgeon, and I'm here to talk to you about fixing your skin with a laser. Now, in the end of the day, you can watch some dermatologists teach you about preventative skin maintenance and lotions and creams, and I'm gonna leave that to them. My job is when you have marks, wrinkles, pigmentations, fine lines, age spots, sun damage, what are the things you can do specifically using a laser? Now, in the end of the day, it's a crazy market out there. Why? Because most med spas and doctors' offices have a laser and everyone's telling you the one they have is the best out there. And I'm here to tell you the one I have is the best out there. I'm just kidding. Well, I'm not completely, because I do truly believe in our laser. Lasers are a variability. What you put in is what you get out. And that's the truth for any device. There's devices such as a laser called Fraxel or an IPL laser that are simple, very minimal downtime, lower costs, and they hurt less generally with an easier recovery. The truth is that the laser, the amount of downtime, cost, recovery, and energy that goes in is equivalent to the results you're gonna get. That doesn't mean you can't take a light laser and do multiple treatments to get to a similar end goal, but there's definitely some things the stronger lasers can do that the weaker ones can't. I spent almost a decade trying to find the right laser from two perspectives. Number one was what I call tunability. Can I dial it from a 0 to 100? Can I change the depth and go from a light skin treatment with minimal downtime to a heavy treatment? And second, what types of patients does this treat? Does it just treat texture and tone? Does it treat fine lines? Can it lift skin? And can it treat different types of patients, from a light skinned patient to a dark skinned patient? Well, in that laser, I discovered UltraClear. UltraClear is a laser where you can tune it, and it was at a price point that for patients, I can get a lot more who can afford it compared to other products. Now, in the end of the day, the technology is what stands out. It is a newer technology, but it's very similar to our more ablative and fractionated treatments, which means we're breaking up the dots or making one smooth layer to remove everything, and that's gonna be your CO2 or ND-YAG lasers. When I use these words, they really refer to the energy source or the wavelength of the energy source we're using. From a patient's perspective, they can get more energy to the tissue while causing the exact amount of controlled damage that we're looking for. All of this is called skin resurfacing. We're trying to wipe away that skin, whether it's all of it or little dots of it, where you're leaving behind a certain percentage of it. We're trying to put the exact right amount of heat and energy so you don't burn, but you don't hyperpigment, and you just get the skin enough where it's like a sunburn that once it's healed and wiped away, you're born with fresh new skin. Not to confuse anyone, but there's a whole nother category of devices out there. This is the category to not confuse. They are not skin resurfacing, and that's gonna be your energy-based skin tightening devices as they're known. Be very careful, because these radio frequency microneedling devices are not the same. With these, you're providing mechanical trauma and an energy to apparently tighten the skin, but the clinical efficacy is not the same. Find me a Morpheus 8 before and after taken in the same lighting, similar lens, that's an actual amazing result. Yes, if you squint your eye just right, you might be able to find one of them, but consistency is not going to be the same. You're always going to be told you need multiple treatments, and it's going to be sold by everyone, anyone from dentist's office to optometrists to med spas. You have to be very careful, and a lot of these are sold to doctors, not on the basis of efficacy and clinical studies, but I have a story, which maybe in a different video I'll share, where they're sold to you, where the rep who comes in with a background in business comes in giving you a marketing strategy and an ROI on how much money you're gonna make off the device without showing you or telling you about the device. Be very careful with these, and they do not equate. Now, in the end of the day, everything has a place, but I would be very cautious in saying that these are tunable. They're only utilized in certain percentage of the population, where people come in and say, I would like to improve my texture and tone. Would a series of 3 Morpheus 8 treatments be able to accomplish that? Probably not for the vast majority of people. I know it's not their fault because they're not the ones doing the marketing, But believe me, when they come into your office and these device companies are telling us what the device does, it's not the same as what's being told to you. Now, back to the skin resurfacing lasers. The other problem with lasers is the deeper we go, the more we lose the ability for our pigmentation to come back normally. For example, a CO2 laser in someone with black or dark skin such as mine was always a no. My skin would come back hyper or hypopigmented rarely and look worse than when it began. So that's never a possibility. Now with the laser that we have, we can treat things such as acne scars and age spots in skin as dark as mine. My mom did a treatment a couple weeks ago using this laser, and also treat someone with severe wrinkles and even jowling using a mode called laser coring, where we're actually coring out areas of tissue in particular areas to get a lift. Now it's not going to be the same as a facelift, but you can get a subtle improvement, and it's ideal for someone who's just starting to notice some jowling in their early 40s. Now, I know this is a lot of information. Hopefully it gave you the 101 on understanding the differences between radiofrequency microneedling, which is gonna help with texture and tone, not skin tightening, and skin resurfacing, which is gonna help with actual texture, tone, wrinkles, fine lines, and actually smoothing out your skin. Remember, what you put in is what you get out. You need a laser and a provider that's going to be able to have that discussion with you. Hopefully this leads you to a lot of questions. Leave a comment and question below. Don't forget to like this video and subscribe to this channel.